Hello guys, so now we shall be discussing regarding the anatomy of the scrotum. Okay, so a topic of discussion would be regarding the scrotum. Now regarding the scrotum, few important things you need to know. What are these few important things are? First of all, let me draw this thing. Let us say this is the scrotal sac, and next important thing is that in the center of the scrotum you have got a partition, right? You have got a partition in the center of the scrotum. This is called as a raphe. What is this partition over here? This is called as raphe. And second important thing you know better, that on the scrotum, the scrotal skin is not smooth, right? It is wrinkled. Now why the scrotal skin is wrinkled? What is the use of these wrinklings and all? I will explain it to you in a minute. Okay, but before that you need to know that the scrotal skin is not linear, it is wrinkled. Okay, right. Second important, for example, when I cut down this scrotum, when I make a section of this scrotum and when I look at the things that are located inside to this, what are the things I will find? So this is your scrotum here, this is your scrotum all the way, and if you look at the raphe, this is how the raphe is. So this is a scrotal region, and if you look here, just beneath the skin of the scrotum, okay, just beneath the skin of the scrotum, you have got a muscle like this. You see a muscle here? So this is a muscle that is located just beneath the skin of the scrotum, and it is continuing all the way from one scrotum to another, right? I mean the one part of the scrotum, one half of the scrotum to the other half. Scrotum is only one, right? So it is continuing from one half of the scrotum to the other half. So this muscle which you can see over here, this is called as Dartos muscle. Okay, now why this Dartos muscle is really needed is that you know that you have got testis in the center. You have got testis in the center over here. So these are your testis like this, right? Now I am rubbing this testis. Now you understood where your testis are located, right? So to maintain the temperature, sometimes you know your scrotal skin is contracted, right? So when it is contracted, there are wrinkles that are produced, you know. Now these wrinkles which are produced while contraction of the scrotal skin, automatically it will contract subconsciously, without your without your voluntary movement itself. Automatically the scrotal skin will become tight and sometimes it will become very loose. Now the reason behind that is because of this Dartos muscle. This Dartos muscle, when it contracts, the scrotum becomes very small, right? Again, when this Dartos muscle will relax, the scrotum will hang down. Why is this happening? Why is this happening is that when the Dartos muscle will contract, when the scrotum is becoming small, it means the surface area of the scrotum is less. So the lesser the surface area, the lesser the exchange of temperature, right? Yes or no? So if the surface area is greater, then the temperature exchange will be too much. So to minimum, right, to reduce the temperature exchange, we need to decrease the surface area. For that we need this muscle called as Dartos muscle. So this muscle over here is your Dartos muscle. This is called as your Dartos muscle. Now apart from Dartos muscle, you have got another important muscle also. Okay, so this is a particular muscle that is located over here. So apart from Dartos muscle, you even have got another important muscle like this. You see another important muscle that is located over here apart from this Dartos muscle. So this muscle over here which you can see is called as a Cremasteric muscle. So let me draw the border line of this Cremasteric muscle so that it would be easy for you to identify. You see this particular muscle over here, right? So this particular muscle which you can see over here is called as, this one over here is called as cremaster muscle. So how many muscles in the testis we have got? We have got two important muscles. The outer muscle is called as a Dartos muscle, which regulates the temperature, right? So this is the muscle which is responsible for the wrinkling of the testis, okay? Apart from this, another muscle that is called as a cremaster muscle, which we have over here, right? Now, between the two testes, okay, between the two testes, you actually have got a septa. Between the two testes, separating the two testes right from the left, you have got a septa like this. So, this particular septa which you can see over here, right, this particular septa which you can see over here is nothing but called as scrotal septum. This particular septum is called as your scrotal septum. So, one is called as your scrotal septum, another one is called as your dartos muscle, as well as the cremasteric muscle over here, right. So, if you have to write down the definition of what is the scrotum, what you need to write it, guys? Scrotum is nothing but the fibromuscular as well as a cutaneous layer, okay. It is a fibromuscular as well as a cutaneous layer. Where is this cutaneous layer located? That is located in between the penis as well as the anus, right. All of you know that scrotum is hanging between the penis as well as the anus. So, it is a fibromuscular cutaneous layer or sac located between penis as well as the anus. Okay, fibromuscular cutaneous layer located between the penis as well as the anus. Now, if you look at this particular thing regarding the contents, of this, what are the different contents that are present within the scrotum? The first important content over here is testis. Now, regarding this testis is the main site for the sperm production. Testis is the main site of sperm production. Okay, so testis is the main site of your sperm production. Now, after this, the second important thing over here is on the superior side of the testis. For example, if this is the testis, on the side of, on the top of the testis, you have got this particular structure. This is called as epididymis. Okay, so this particular structure is called as epididymis. Okay, so this is called as your epididymis. Where is this epididymis located? This epididymis is located at the head of each testicle. And what is the use of this epididymis? This is responsible for the storage as well as the reservoir of the sperms. Okay. So, what is this where is this epididymis located? It is situated at the head of each testicle. Okay, and it is responsible for storage and reservoir of the sperm. Responsible for the storage as well as the reservoir of the sperm. Okay. Next important thing, or the third important thing over here is spermatic cord. Spermatic cord. So, what are the contents so far we discussed? The first important content is the testis. Second important content is the epididymis. Third important content is your spermatic cord. Now, regarding this spermatic cord, important thing I want to tell you is that what is spermatic cord actually? A collection of nerves, a collection of muscles, a collection of arteries, a collection of veins, all of them, and not only them, even ducts. Okay, arteries, veins, nerves, ducts, muscles, all of them together, you call it as a spermatic cord. Okay, so spermatic cord is simply mean that it is a collection of muscles, vessels, nerves and ducts, as well as ducts. All of them together you call it as a spermatic cord. Okay, right. Now, when it comes to the vessels, what are the different kinds of vessels that are supplying to your scrotum? First of all, let us look at what are the arteries, what is the arterial supply to the scrotum. The first artery is anterior scrotal artery. anterior scrotal artery. Now when I tell anterior scrotal artery, there should also be posterior scrotal artery. Posterior scrotal artery. So there are two arteries, one is called as your anterior scrotal artery and the other one is called as your posterior scrotal artery. Now anterior scrotal artery is a branch of what? External pudendal artery. It is a branch of external pudendal artery. And posterior scrotal artery is a branch of what? Internal pudendal artery. Internal pudendal artery. So anterior scrotal artery is a branch of external pudendal artery and posterior scrotal artery is a branch of internal pudendal artery. Now after that, what about the veins, right? So what are the different kinds of veins we have got? So all these veins which are present to the scrotum are called as scrotal veins. They are called as your scrotal veins. And where do these scrotal veins drain into? These scrotal veins drain into external pudendal vein. These scrotal veins drain into external pudendal vein. Okay, these scrotal veins, they drain into external pudendal vein. Right. So coming to these scrotal veins, all these scrotal veins, where do they drain? They drain into your external pudendal vein over here. Okay. Now let us discuss what are the different kinds of nerves. So nerves we will discuss on two bases, guys. One is what are the nerves that are supplying the anterior aspect of the scrotum and what are the nerves that are supplying the posterior aspect of the scrotum. For example, if you look at the nerves that are supplying the anterior aspect of the scrotum, what will be the nerves? The nerve is anterior scrotal nerve. Anterior scrotal nerve. Okay, so from where this anterior scrotal nerve is coming? Anterior scrotal nerve is a branch of, it is a genital branch. Okay, so it is a genital branch of genitofemoral nerve. Genitofemoral nerve. It is a genital branch of your genitofemoral nerve. So genital branch of genital femoral nerve will give you anterior scrotal nerve. Okay, next important thing is the posterior aspect. If you look at the posterior aspect, so in the posterior aspect, what is the nerve which you see? Posterior scrotal nerve. Posterior scrotal nerve. Okay, now from where this posterior scrotal nerve is coming? This posterior scrotal nerve is coming from the pudendal nerve. Pudendal nerve gives perineal branches. Okay, so these perineal branches, one of the branch is the posterior scrotal nerve. So it is coming from the pudendal nerve. It is coming from the pudendal nerve. Now coming to the lymphatic system. So the lymphatic system, coming to the lymphatic system, you know, all the all the lymph nodes, whatever are present within the scrotal region, where are these lymph nodes draining? All these lymph nodes will drain into superficial inguinal nodes. They are going to drain into superficial inguinal nodes. So they are going to drain into superficial inguinal nodes. Okay. So these are some of the important things which you need to know regarding the scrotum, guys. So thank you so much for watching my video. Goodbye.